Good afternoon. Thank you, MISSABSCON, for giving me the opportunity to present on this very much great podium. I am presenting on behalf of Dr. Bharat Dave, and the topic is New Age Material for Spinal Fusion, Titanium Nanolock Surface Technology. Regarding interbody fusion, it can be done via only bone graft, titanium cages, or PIC cages. The fusion techniques is like only bone graft, secondly the titanium cages, the banana cage, the PIC cage in bullet, and olive cages. The types of cages, and now we shift over to another new concept of titanium nanolock cage. With this literature support regarding which one is better, a titanium cage or a PIC cage, in a so-called article published in European Spine Journal 2021, it stated that in non-infective spine surgeries, titanium cages are more superior to PIC cages in view of superior fusion status. Another publication in Spine Journal, it compared between the smooth titanium, the rough titanium, and the PIC cages. BMP2, BMP4, and BMP7, other protein increased to twofold in rough titanium as compared to the smooth one, and the PIC failed to increase these molecules. So the osteogenic environment which created that in the rough titanium were much higher as compared to the smooth one and the PIC cages. Another literature that is published in the Spine Journal suggested that the angiogenesis support reduced osteoclastic activity were much higher in case of the rough titanium alloy. The osteogenic angiogenic response to titanium alloy were greater than PIC. Surface features regulated expressions of integrins important in collagen recognition, and this factor increased the bone formation, enhanced integration, and improved implant stability. Next paper published in 2015 stated that in microscopic scanning, that is scanning electron microscopy, a combination of appropriate microsurface and nanosurface features yield a highly desirable surface for rapid integration of bone implant interface. Similarly, article published in Spine Epidemiology, first they stated the advantages of a PIC cage which was modulus similar to bone and fluorovisibility, but the disadvantages were it created a fibrous encapsulation in compared to the titanium one which had a micromotion, high rate of subsidence, and non-union. So a newer age material for fusion is titanium nanolock, which has a honeycomb structured over the surface and a smooth dolphin nose, and which had a better advantage of more bony surface contact area, minimizing the stress load on the end plates, decreased subsidence chances, osteoconductive scaffold for bony ingrowth for implant. The case one, she was a 45-year-old lady with 4-5 lateral aesthesis in which nanotechnology, that is Adapix nano cage was used in the particular institute. Second, with the similar 4-5 and 4-5 nano cage along with Miss Tilif was done. The follow-up 8 weeks showed increase in the fold of union as compared to the other cases. I have a CT scan stating the state. This was immediate per-op CT scan, and this was done in a 4 months interval.